Hi, I'm George of Contour Fitness, and today I'm just going to take you through how to ease postnatal back pain. So this is specifically lower back pain, and it's a common thing just because of certain things that happen with your body during pregnancy and in the postnatal period. So one of the major causes of back pain is a weak abdominal wall, which is very common. Your uterus has grown and it's stretched your abdominal wall. And whereas your abdominals usually work as a belt around your back, protecting your spine, because they've become weakened, they just don't provide the support anymore. So that's one of the causes. You've got also the fact that during pregnancy and following that period, you've got a build-up of hormones, so things like progesterone and relaxin, those sort of things, they tend to make joints not as stable. So whereas before they were locked in together, now it allows a little bit of movement, which means that you're gonna have a bit of movement which might be pressing on nerves, which can cause that pain. And another thing in the postnatal period is your posture. So you've got to really think about how you're sitting, how you're standing, how you're breastfeeding, how you're carrying your baby. So if you're carrying your baby on one side, that's going to be putting pressure on one side, which can lead to a bulge on the other side. If you're hunched over doing your breastfeeding, which is a common thing, you'll find that the pressure can be coming from the back. So what I really want you to focus on, if you do have that pain, is to focus on your posture. And then also, not immediately after giving birth, because your body's not quite ready for it. You'll have a checkup between 6 and 8 weeks after giving birth, and that's when your doctor or healthcare provider will give you that advice that you can go back to exercise. What I'd say is do that, and then you can ease your way into a gentle exercise program. So doing things like hip tilts, which is basically twisting your pelvis. And what I want, if you want to do that, there's a way of doing it where you lay on your back, feet flat on the floor, so that means your knees are bent up, and what I want you to do is tilt your tailbone towards your belly button. So that's trying to squeeze up, twisting your pelvis forwards, hold it for a second and release. But what I want you to do is as well, you can exhale through that, so you breathe in and then exhale as you twist your pelvis up, bringing your tailbone towards your belly button, and at the same time squeeze your bum. So squeeze your glute muscles at the back, just so that they're getting tightened and worked. As well as that, just remember, correct your posture. That's one of the main causes. And you can also start an exercise program. So just a gentle one. Don't go back into the things you were doing before, because you can cause a bit of injury. But things like postnatal classes, a bit of postnatal yoga, that sort of thing, they're really good for strengthening your core. So your core is the bit that I said before that has lost a bit of its strength, and it's become stretched. So what you want to do is really strengthen that back, bring it back together, so that you've got that tight belt around your spine. But that's kind of what causes back pain and the sort of things that you can do to help it out. So that's my story from today, and I hope that helps. Cheers.